Hello and welcome. Let's talk about bone healing. So, what does it mean by bone healing? It is a process by which an injured or fractured bone undergoes a series of changes from inflammation to leukocytic activity to open bone and cartilage formation and ultimately to remodeling of new bone. Now, stages of bone repair. Stage 1, which includes hematoma formation. Stage 2, acute inflammation due to trauma and fluid exudate and neutrophil infiltration also occurs. Stage 3, macrophage activity and neutrophils are replaced by monocyte infiltration and macrophage activity. Stage 4 includes formation of granulation tissue, and by the end of the first week, hematoma is organizing, which is known as procallus. New vascularization and fibrogenesis occur from the periosteum to endosteum. Stage 5, open bone and cartilage formation. Osteoblast and chondroblast are derived from periosteum and endosteum, and the calcified hard tissue is called callus. Stage 6 includes open bone and cartilage are removed, lamellar bone formation, and progressive calcification and Haversian system formation. Stage 7 includes remodeling. The original structure of the bone is formed by remodeling process by osteoclastic removal and osteoblastic lying down of bone. The intermediate callus is converted into compact bone, the external callus is removed, and the internal callus is hollowed out into a marrow cavity. Now, this picture shows stages of healing bone fracture, where on first week hematoma is seen, and on second week internal callus, external callus, spongy bony trabeculae are seen, and 1 to 4 months bony callus of spongy bone, and 4 to 12 months consolidated fracture is seen. Now, clinical signs of healing. The load on the fracture produces no movement and no pain. The fracture site is not as strong as the bone around. Now, direct or primary bone healing. This occurs without callus formation. It is like the normal process of remodeling with cutting cones crossing the fracture and new lamellar bone being laid down. It tends to occur when the fracture ends are closely opposed and there is no relative movement between them. Indirect or secondary bone healing. Indirect or secondary bone healing occurs with a callus precursor and is referred to subchondral ossification. This tends to occur when the bone ends are not perfectly aligned and when there is some movement at the fracture site during the healing process. It may be thought of as the natural way for a bone to heal. Such secondary bone healing is broadly characterized by three main phases: inflammation, repair with callus formation, and remodeling of immature open bone to mature lamellar bone. Now, adverse outcomes of bone healing includes malunion, non-union, infected non-union, and delayed union. Now, what are the rule of bone healing? Lower limb takes twice time than upper limb to heal, and fracture in elderly takes twice time to heal than fracture in children or younger, and transverse fracture take longer time to heal than spiral or oblique fracture. There is no fracture units before 3 weeks. In children, upper limb takes 3 weeks, while lower limb takes 6 weeks, and in adult, upper limb takes 6 weeks and lower limb takes 12 weeks to unite. Now, what is callus? Callus is defined as the osseous material woven between the ends of a fractured bone that is ultimately replaced by true bone in the healing process. What is non-union? Non-union of a fracture may be defined as a failure to show progressive clinical or radiographic signs of healing. Delayed union means failure to reach bony union by 6 months post-injury. This also includes fracture that are taking longer than expected to heal. Malunion. Malunion is a clinical term used to indicate that a fracture has healed, but that it has healed in less than an optimal position. End of the topic.